I'm just waiting for the viewers to join, just for a few seconds. I'm going to start in another 10 to 20 seconds. Yeah, good evening, viewers. I'm Dr. Shailesh, Senior Glaucoma Consultant at Shekar Eye Hospital, Bangalore. So today I would like to introduce you to a very important topic, that is glaucoma blindness. It's a very important disease in the eye. So I will discuss about the various aspects of this blindness, how to prevent and how to treat this glaucoma blindness. I will take you through a few of the slides so that you can understand better. Now, how to avoid glaucoma blindness? See, blindness can be caused by various reasons, and glaucoma is one of the important cause. And I will just discuss this glaucoma blindness under these subheadings so that it is easy to understand. Like, you should know what is glaucoma first of all. So then who are affected, then the risk factors, and what are the symptoms that one faces, then how it can be detected, then how dangerous this glaucoma can be for the person, and what are all the various treatment options, and a very important question, is it preventable? So now what is glaucoma? See, glaucoma is a disease of the optic nerve. So optic nerve is a nerve going from the eye, back of the eye, to the brain. It takes the signals of the vision to the brain, and it is associated with the high intraocular pressure, eye pressure. So normal eye pressure is less than 20 millimeter of mercury. So the pressure should be usually more than 20 millimeter of mercury in the eye in glaucoma patients. Then it's a silent disease, but that's why we call it as a sneak thief of sight. It slowly takes away vision without the knowledge of the person. Then it can cause irreversible loss of vision. That means you cannot get back the vision once you lose the sight because of glaucoma. So that becomes a very dangerous proposition as far as glaucoma is concerned. Now you know the normal architecture of the eye. So this is the cornea, lens, this is the retina, and this is the nerve. This is the main nerve that's called optic nerve, which takes the signal from the eye and goes through this optic nerve and through the brain. So the brain will pick up those signals and will have the visual perception. So this is the nerve which gets affected because there is a pressure inside the eye which is beyond normal. So this will press this nerve, and then that nerve gets compressed, and then it causes all those visual retinal nerve fiber layers, or what is called as optic nerve fibers, which gets damaged and cause loss of vision slowly. And this is the nerve image which we see from inside. This is the normal optic nerve head. This is the nerve head which gets affected. Now, just to give an idea that this is the normal nerve, what I was talking about, the optic nerve, this is what is called as the cupping, the inner circle. Then we see in the advanced glaucoma patient, you can make out the difference between these two. This is more reddish, and there is a very small whitish circle. Here, the whitish circle is quite big. This is called as cupping, or this is called as the optic nerve damage, optic nerve head damage. This is what happens in glaucoma. This internal part of the disease. Now, how common this glaucoma is? Amongst these eye disorders, refractive, that is those who are wearing glasses, that is becomes a common cause of visual loss or poor vision. Then comes cataract, that's common age-related cataract. Then third comes the glaucoma. So it is in the top third list where it can cause visual impairment. And rest of them are diabetic retinopathy, age-related changes, and so many other things. Let me focus only on the glaucoma. Now, the burden of glaucoma, see why I'm discussing glaucoma, and a lot of people are always chatting about glaucoma compared to cataract is, see, amongst these eye disease, this glaucoma burden is about one fourth, or rather one third, because it becomes more important. This pie is occupied by cataract, and these are the other diseases. But see, this major chunk also is because of glaucoma. This is so important because if we can treat all these other diseases, we can get back the vision for all these diseases. But for the disease like glaucoma, we cannot get back the vision which is already lost. That is why it is a so important and so dangerous disease if you don't treat it properly. Now we all get confused, like, oh, okay, doctor, what are all the age group that glaucoma can affect? So there is no age restriction actually. It can cause Glaucoma can be caused in a very young newborn also, like this, where we have a very big eyeball and all we can easily detect, and the child will have watering, and then there will be whitish membrane kind of a thing that is seen on the cornea, the white black portion. And another one is the middle age group, that sorry, in the age group of about 15 to 30, 35 years of age group, that is called juvenile onset glaucoma. The other types of subset of glaucoma is secondary glaucoma. It can be seen in any age because of injury or some internal disease of the eye. They can develop glaucoma. Secondary to any cause. But by far the common cause or common age group is about 40 years of age. So we can have a full range of age group where glaucoma can be affected. But common being this middle-aged age group, that is about 40 years of age, is a common age group. Now, who are at risk for glaucoma? So age above 40 years, as I told you, then high intraocular eye pressure. Then there is a family history of glaucoma, very important. Someone in the family has suffered because of glaucoma, or an unexplained vision loss, or they are putting eye drops for a longer time. They are the ones who are glaucoma patients, and they need to be assessed properly. Along with that, their family members should also get checked there for their eyes, because it runs in family. It's a very important factor. Then there is a far-sighted or near-sighted, there's myopia or hypermetropia. They are wearing glasses, high number. They are also at risk. Then those who are on steroid intake, like those patients who are being given steroid eye drops, or for some eye allergy or some other condition, the doctor usually must have prescribed for a shorter duration, but the patient will continue whenever they have the similar situation for a longer duration, maybe months and years on end. So that will cause slow damage to the eye and cause increase in the eye pressure and damage to the nerves. They come with a lot of advanced glaucomas we see. So steroid intake is one important thing, and we should not self-medicate unless the doctor advise. Then there is any injury to the eyes in the past or in the short duration. Maybe in the initial time of injury, there will be small disturbance in the vision and it will become okay. But they can have an onset of glaucoma behind the eye. So we should get it checked. So trauma is one thing. Those who have undergone shuttlecock injury or cricket ball injuries or fist injuries, we commonly see those kind of injuries going in for glaucoma. Now, the diabetes also can cause glaucoma. It's called neovascular glaucoma, which are uncontrolled. So very important to have a eye checkup done in diabetic patients, and hypertensive patients also. Those who have high BP should also get their eye checked. Then those who have migraine headaches and also these vascular causes also can cause glaucoma. So what are the symptoms? See, now coming to symptoms, we should know the types of glaucoma to assess the symptoms. See, usually open angle glaucoma and angle closure glaucoma are the two common types of glaucoma that we see. In open angle, this angle means there is an internal structure of the eye where the fluid is formed here and goes out like this and gets drained into this anterior chamber angle. This is a normal mechanism. Obstruction to inside the eye. This is called as open angle glaucoma. But in this case, this is the drainage area, but the entry to the drainage area itself is blocked. That is called angle closure, but the angle is closed or it is narrow. So this is the two types of glaucomas. In open angle and angle closure almost have a different types of presentation. Like angle closure glaucoma is one type of glaucoma where patient have symptoms. They have those problems like in eye pain, severe pain, sometimes some redness and on and off. They have transient blurring of vision or a continuous blurring of vision when they come from dark to dim light or dim to dark light. They go, so they will have this temporary blurring of vision, and they see colored lights or the colored halos around a white light. So that's one typical presentation usually a person has when there is angle closure glaucoma. That says that the pressure is building up and the eye is at risk. So we have to immediately report to the eye doctor. Otherwise, people can lose sight within a day or two if it is going beyond control. So immediately report to the eye doctor if you have these kind of symptoms. It can be because of angle closure glaucoma. Another type of glaucoma, as I told, open angle glaucoma, the angles are open, but the drainage area, the openings are blocked actually. The micro blockage is there. So the fluid doesn't drain out and the pressure builds up. So this is the most common type, and it does not have any symptoms. That is very important. They don't have redness, pain or anything. And there is no warning signs like the previous kind of glaucoma. And that's the one typically branded as a silent thief of vision. So this is why we discuss, because patient does not have any symptoms. There is no pain, redness or anything. And it's a common type of glaucoma, and they will have developed symptoms when this situation happens. See, I will show you. This is a glaucoma vision loss. This is the normal appearance to a person when there is no eye disease, no glaucoma, anything. Now, this is the case of glaucoma. You can see the peripheral vision is lost. See, the vision from the periphery gets affected in the glaucoma initial stage. Then once the advanced stage, then the central vision also gets affected. That's why people will fail to recognize glaucoma in the early stage, because they won't understand that this vision is gone unless you get it tested by eye doctor by a proper test. So that's why we miss out. Only they come at the last stage, at the advanced stage, where the vision is only tubular vision, what we call very small vision is left, and they say, doctor, I can't see anyone coming from the side. And we can see only when they come bang in front of me. Even they, while driving also, they can't see the sides. They will see only the person when he comes more in front of you. That means this side of the vision is gone for that person. So that is very important. That is the stage where patient comes in open angle glaucoma. That is what the importance here is, that patients will not recognize early. They will recognize only in the last stages. That's why whenever anyone is at 40 years of age, we should come and get it. So how do we detect this glaucoma? So first thing is we do have an eye examination at our eye hospital or all the hospitals. We have an eye checkup done for all the patients, where we check the eye pressure, intraocular pressure, what we call, and do this gonioscopy, then optic nerve examination, then visual fields, pachymetry, measure the thickness of cornea, then optical coherence tomography to measure the retinal nerve fiber layer thickness. Then other tests, if required, is advised by the doctor depending on the condition. Now, how do you measure the eye pressure? There are various. This is one more important aspect of any glaucoma treatment is the eye pressure. So this is normally less than 18 to 20 millimeter of mercury, and this is measured by a lot of equipments. One of them become non-contact. The ear puff is passed through the equipment, and it will touch the eye, and then it will measure the eye pressure. And other eye pressure measuring equipments are there, which we measure the eye pressure. Okay. So second thing is that we do gonioscopy. There's one more small lens we put on the eye, so that we will see the inside part of the eye. We will see this open angle or closed angle type of glaucoma, because the treatment will also have slight variable in these kind of situations, and the prognosis also will be slightly different. So we subject them to this simple computerized test. Actually, there is not painless thing, and we can do this test. And one will also take the image of the eye, inside the eye. This is what the normal looking eye image of the eye. This is the retinal or the optic nerve head photo. So this is the advanced type of glaucoma. You can see this one image, this image. There is a difference in these two images. This is what we see. We will make a photograph of this, and then we can have follow-up of these conditions, or you can show to any other doctor where you visit. So we'll have a documentation of these things. Now, in early stages, these kind of glaucoma can be missed just by small examination. We have to quantify it, and then these equipments will help us see to measure the optic nerve thickness. See, I told you optic nerve head gets affected here. So this is the right eye image of the OCT, and this is the left eye image. See, all green color is normal. See here, the right eye is the one which is affected. See, there are circles or segments which are green, and there are segments which are red. See, those red segments or the pies which are this colored have got damage to the nerves. So almost more than 50-60% of the nerve is damaged. Only hardly about 30-40% of the green areas, that is the normal looking nerves, is there. So patient is seeing through these green areas. Compared to the other eye, it is absolutely green and it is normal. So we can easily make out that there is something happening in the eye by the test. Now this test helps us to monitor over a period of time whether the glaucoma is in the same position or in the same situation, or is it worsening, because we can't reverse what is being damaged. Here, these red areas, we cannot bring it back. These damaged areas, we see this is the nerve. All around there are some red patches. These red patches means these areas, the nerve is already gone. It's all lost. Only on the side areas, the nerves are intact, and the person is seeing through these areas. So this will help us in follow-up, so that we can see that any treatment options can be modified or not. I will tell you the treatment parts next. Another important test we always advise, or all the eye doctors advise, is the field test or the perimetry, where the person is made to sit on the machine, the computerized machine, and you'll be asked to press the button whenever a light is shown on your screen. So this is the normal field testing, where the person is seeing all the lights. That means he's clear. There is clear white. That means he's a normal individual. He sees all the light that is being shown by the perimetry machine. Now, compared to this chart, you can see there are black areas. See, this area is blacked out. These are all gone from this area. So that means this is already a glaucoma changes. It's almost moderate to severe kind of glaucoma we can see here. So this is a stage where we have to be very, very careful. See, these are the black spots where the person is not able to pick those spots when we are showing light by the perimetry machine. So this is what is the field testing or perimeter testing, which has to be done regularly, and many times we have to do it 3 monthly or 6 monthly, depending on the type of glaucoma and the severity of glaucoma. Now we can see, I will take you through this early stage of glaucoma, how the field looks like. There are small black spots coming here. This is the moderate stage of glaucoma. Okay, see there's a black spots here covering. And this is the advanced stage of glaucoma. You can see only the small central white patch. He is seeing through this small tubular vision. This is the advanced stage of glaucoma. So we should never allow the person to come to this stage of glaucoma. That's why it's important that we have to arrest the person or detect the person in the first or maybe second type of category. That's early or moderate stage. So we should never allow the person to come here, because it's already gone. About 80 to 90% of the eyesight is gone. The useful vision is gone. Now, there are other tests also is done to see assess the angles and other obstructive pathologies inside the eye, UBM, and depending on these things, the doctor will advise. Now, what is the treatment? Let me come to the main part, is the treatment part. So definitely there is treatment for glaucoma, and the treatment modality will be usually medical line or the surgical line. So medical line is the first one which we start with eye drops. Then in some situations we do lasers like YAG laser or SLT, that is selective laser trabeculoplasty laser, we do in some situations. Surgical part is the glaucoma filtering surgery. I will tell you in the coming slides. So this is the laser that is done in glaucoma. This is called selective laser trabeculoplasty, where we put light laser on a selective openings in the eye, in the angle. See, we can throw a light on the laser light into the angle where the small microscopic openings are opened up by this laser. So the fluid goes out so that the pressure gets reduced. So this is one painless laser procedure we commonly do in the early stages of glaucoma, or in where we want to reduce the eye pressure further beyond one level of pressure. So this is one laser that we do regularly. It just hardly takes about 2 to 5 minutes depending on the cooperation of the patient. Now the other part is YAG laser iridotomy, where we put laser. This is also similar to that. We put a laser on the iris. So we put the laser on the iris, making a small microscopic opening to allow the fluid to escape, because there is a block in the total drainage site. So we will bypass the drainage site by making a small microscopic opening. It's called YAG laser iridotomy, peripheral iridotomy. Many times you go to the eye doctor and after examination they say you have to undergo this laser iridotomy, because it can lead to acute attack of glaucoma. If you are not treating them as a preventive laser, the person can lead into acute attack of glaucoma, which should not be happening. So we should get it done, the YAG laser iridotomy, to prevent for sudden attack of glaucoma and for subsequent loss of vision. Now coming to the main part is the medical line. That is, we give a lot of eye drops in glaucoma patients. There are so many wonderful drops are available in the market, and one has to be used to these drops, how to apply the drops and all. So we start with one drop usually depending on the eye pressure, and in sometimes we have to give 2 types of drops, and sometimes we will give 3 drops also. And if even 3 drops also doesn't work, then we have to resort to other methods, maybe laser and then surgical options. And putting drops is very important. We should never forget to put drops. Doctors, we say that you put the drops for about 3 months and then come. But the patient assumes that doctor has told only for 3 months, and he may not come after 3 months. He will wait for another 6 months or 1 year or some other reasons. He will come after 1 year, maybe after 2 years. So that only he has put the drops for 3 months, and the eye is controlled only for those 3 months. But the rest of the period which he has not put drops, the damage keeps happening and the patient is losing the vision. So never stop the drops without the doctor's opinion. And whenever they advise you for 3 months or 6 months, put that till the drops are over, then immediately go and show to eye doctor, so that there is a continuity is always maintained. So why we call after 3 months or 6 months to assess whether the pressures are controlled or not, whether there is any progression or not. Based on that, we will adjust the drops or do some tests on a regular basis. So this is one laser I told you in acute attack glaucomas. We make a small opening in the iris and the fluid will be blocked here. Then they will allow the fluid to escape from here. So the fluid starts going here and the pressure equalizes from the front chamber and the back portion of the eye. So angles open up and the pressure reduces. This is very commonly done procedure as OPD procedure, and it helps in a lot of patients in reducing the eye pressure and subsequently sight loss. Now another important aspect of glaucoma is the glaucoma surgery. This is the last resort we do in case of glaucoma, because we will start with the medicines which it doesn't work, and sometimes patient develop resistance. We'll go for the second medicine, sometimes the third medicines. Many times the medicines will have its own side effects, the redness, people have the dryness, irritation, watering. So we'll change the medicines from one category to another category, sometimes from one brand to another brand. So we'll see that which one suits to the patient's eye, then which one also even meets our requirement. That means the reduction of the eye pressure or the control of the glaucoma status. So if the patient is also comfortable with the drops, if the doctor also feels that the drops are doing its job, then we'll go with those drops. So it can be 1, 2 or 3. But many times the pressure keeps rising despite of putting all the drops. Sometimes the pressure appears normal with drops, but the disease keeps progressing, what we call as normal tension glaucoma, where the tension is normal but the disease keeps progressing. That's why we do this test regularly to assess whether the glaucoma is progressing or it is stable. So our aim is to keep it stable, not to allow it to progress. So to prevent progression despite of putting drops, and in advanced stages we resort to the surgical options. Surgery is one more weapon in our armamentarium which will reduce the eye pressure. Of course, surgery also has got its own limitations, side effects, but there is no other choices. If you don't do it, even the whatever that is left will also go away. So that is one thing. So we should remember that glaucoma is done in addition to the drops also. Many times by surgery itself, most of the time the glaucoma gets controlled for a certain period of time, because many times the surgery also, effectiveness of the surgery becomes less and less over a period of time. So then we may have to again resort to drops, or maybe sometimes a repeat surgery also may be required in coming years. Many times only one surgery is enough. So this is one important surgery which is done in eye, where what we do is here we will create a small opening here in the conjunctiva and then the sclera, and then the fluid from the eye comes through this opening that we create through the sclera and then comes and accumulate in the subconjunctiva. That is the conjunctiva, the white portion of the eye, what we see. The fluid comes and collected here. We create a small bleb, like it's a small opening, and it is covered by this tissue that is conjunctiva. So examination, when you see there's a raised bump on the upper portion of the eye. This is the area where the fluid from inside the eye gets collected here. Whenever the pressure rises, the fluid, like valvular action, this valve opens and the fluid gets collected here, and it will equalize. So this is what is called glaucoma filtration surgery. There are different types of, in this only there are so many other options available, but this is by far the gold standard eye surgery for glaucoma which is done. And many times even surgery also may not work well, so we have to do repeat surgery and add the drops, and sometimes we do cyclocryo, or what is called as a diode laser cyclophotocoagulation. We will burn those areas of the eye where the fluid is getting formed. So this is one more last resort we will do it, coagulation, but that is a very advanced stage and almost near blindness stages we will do it. But this is the surgery, which is a commonly done surgery and can be done and to restore the vision or to prevent the further loss of vision. Now, this is what I have discussed till now. To summarize all these things, see, glaucoma blindness, nothing to worry about glaucoma blindness or glaucoma. Yeah, we should be aware in the back of our mind that glaucoma can cause irreversible blindness, but it can at the same time be controlled easily in early stages if we detect. And this blindness is irreversible. It's very important to know that we cannot reverse. When the patient says, doctor, you will do surgery, then I will get back the vision. No, you cannot get back the vision. We can only prevent that further loss of vision. Then early detection is the key in the case of further progression of glaucoma. And we always look for the high risk category. So we always should see that 40 plus, those wearing glass, family members having glaucoma, and diabetic patients, please come and get your eyes checked once. Then they have to undergo screening tests initial stages. So just have one small glaucoma eye checkup or a screening checkup. So we'll come to know, is there any glaucoma inside the eye or not. And regular follow-up is very important. Not that many times we brand them as glaucoma suspect. The pressures are on the borderline and the nerve also looks suspicious. So what we do, we don't immediately jump into treatment. We'll just tell them, let us follow up after 3 months or maybe 6 months, depending on the situation. But if you don't get lost to the follow-up, so please follow up sincerely so that we can pick up the glaucoma at that stage. If we have doubt, and the next stage we'll have to start the treatment. So in glaucoma suspicion, we have to have a regular follow-up and get it treated. Now this images nicely summarizes. See, this is the glaucoma boulder, okay. If you don't, this is the actual vision. So if you don't treat it, this boulder goes down, this rock goes downhill, and you will lose the vision. This is very evident. Now what we can do, so this is the glaucoma juggernaut, it keeps coming down. Even natural course of glaucoma itself is that it has a slow downhill. Even if you treat, if you don't treat, see, if you don't treat, it will go steep down and become blind within few months or maybe within few years. If we treat, at least we will maintain some amount of usable vision, or there is a good vision for few years, so that he can manage his life. So we have to stop this glaucoma blindness from going downhill by doing all those screening techniques, what I told you. Just get your eyes checked based on your risk factors, so that we can pick up early. Then we can stop the glaucoma that then and there itself. If it is early stage, we can stop here only. Then early treatment. If you know that there is glaucoma, we can start the treatment, either laser or eye drops or surgery. So whatever that is there, so that we can stop it from further worsening. And regular follow-up. It's a lifelong treatment, just like diabetes, hypertension. You go and check your BP and sugar. Same thing for glaucoma also. You should have a regular 3 monthly or 6 monthly checkup and get your eye pressure checked or normal eye and the test done, so that we see whether you are maintaining the normal vision, or is it stable, or is it deteriorating. If it is deteriorating, we have to change our action plan. We should set our target pressures and see that the eyesight is maintained throughout the lifetime of the person. So our aim is to see that the person who is seeing normally like this should not land up in this kind of a picture where we have lost the peripheral vision, and in due course, if you don't treat him, you will also lose the central vision also. So we should not have this kind of a situation. So we should always have glaucoma treated, and don't let glaucoma blindfold your life. Eyes are very beautiful. The life is so beautiful. Not miss the opportunity to see it, and don't allow the glaucoma to blindfold. Glaucoma and awareness is very important. So get your eyes checked at 40 years of age, or those who are at high risk of glaucoma. And so these situations, if you can get it and treat it early, we can control the glaucoma, you can preserve the eyesight, and you can lead a normal life. So that is very important. And once it is controlled, and you need not worry, but very important is the follow-up of this situation. So regular follow-up will help us to know the situation of the glaucoma and any further modification and treatment is required or not. So with all these few tips, I will end my live chat. Thank you very much for your listening.